Hello, next we're going to talk about hospice and palliative care. There are 4 different types of hospice care. There can be routine home care where the nurse comes and then leaves. You can have continual home care when the patient is clearly getting very close to the end. You can have general inpatient or hospital care for symptom relief. You can also have respite care in a nursing home of no more than 5 days, but that allows the caregiver time to leave to go on a little vacation. There are also volunteers who will come into your home, and you can sometimes get paid personnel to come and stay in your home for a day or even a few hours just so you can go and run errands. And so there are 4 different categories. There are the home health agencies, the hospital-based facilities, so that's an inpatient facility, skilled nursing facilities, again that's inpatient, and then there are freestanding hospice facilities. And those freestanding hospice facilities may also provide home care, so it may be that the patient can come in for a while and then go back home. The main focus of hospice is looking at the mind, body, and spirit. It's a very holistic approach. We discuss death freely. We talk about it and let the patient express what they need to express. We let the family members talk about it. We don't say, oh, don't worry about that. We don't minimize it. We allow them to say what they want to say, but at the same time, we don't push them beyond what they want to do. We use technology and treatments with discretion. We want to follow their wishes about what they want to do, and we don't want to do what they don't want to do. And clients have the right to participate and be a part of the treatment decisions. So hospice requires an interprofessional team. We have to have physicians who write an order for hospice. We have nurses, social workers. There's a whole list of people that can come in and assist the patient and also that work with the patient. And sometimes you may have to have a multidisciplinary conference. You can do this with home health as well, where you're looking at having meetings where everyone sits down and talks about the patient care, and the patient can be included or not included, and that just gives a better scope of care for the patient. We do have children who are in hospice, and that's a very, very special nurse's role. You have to look at the child from their cognitive and developmental status, and you have to understand what's going on within the family and be sensitive to all of that when you're planning their care. You want to be sure that the child has appropriate pain management. There's a tendency to underdose with children. We want to help the child communicate as much as they're able to, and we may do some things where we let them play or role demonstrate. They may draw, different things that they need to do to help express what they need. We also want to be an advocate for the child because the child may not be able to speak. They may be too small to say what they want, and so we use our nursing skills to assess and kind of determine what the patient's needs are. We look at home management and case management, and we recommend bereavement programs to the family after that, such as compassionate friends and other support groups. Next, we're going to talk about faith-based nursing in our next presentation.